Hi everyone, it's Cambria here, and I have a legal nurse breakdown you really need to hear, especially if you or a loved one has ever received long-term medical treatment. A physician from Mission, Texas, Dr. Jorge Zamora Quezada, was just sentenced to 10 years in federal prison for one of the most disturbing healthcare fraud cases we've seen in years. He was also given 3 additional years of supervised release in order to forfeit over $28 million. Here's what he did. Over the course of several years, Dr. Zamora Quezada falsely diagnosed dozens of patients with rheumatoid arthritis, a serious chronic autoimmune disease. These weren't just incorrect diagnoses. According to the Department of Justice, they were deliberately false, made with the intent to defraud major insurance programs, including Medicare, Medicaid, TRICARE, and Blue Cross Blue Shield. What makes this so dangerous is that he didn't stop at misdiagnoses. He ordered a wide range of unnecessary and often painful tests and treatments for patients who didn't actually need them. This included injections, infusions, MRIs, x-rays, and more. Procedures that can have lasting effects on the body, especially if administered over time without medical justification. In total, his scheme resulted in more than $118 million in fraudulent claims billed to federal and private insurance programs. He was convicted of 1 count of conspiracy to commit healthcare fraud, 7 counts of healthcare fraud, and 1 count of conspiracy to obstruct justice. The obstruction charge was related to attempts he made to hide the fraud once authorities began investigating. This case isn't just about financial fraud, it's about violating the most fundamental principle of medicine: do no harm. These were real people who trusted their doctor and instead became victims of exploitation, subjected to treatments that could cause side effects or even long-term health complications, all for the sake of profit. As a legal nurse consultant, I want you to know that fraud like this doesn't just cost money. It costs trust in the healthcare system. And sadly, these cases aren't as rare as we'd like to believe. If you're ever unsure about a diagnosis or treatment plan, especially when it feels aggressive or doesn't match your symptoms, get a second opinion. You are your strongest advocate. Let's keep having these conversations because transparency and education are how we all protect ourselves and our communities.